We woke up and we're feeling great this morning, and we're getting ready for Unique Not Different, where we're talking about optimizing physical health for 2025 with Shamla Maharaj. Check this out.
Good morning, everyone, and welcome to Unique Not Different with me, Shamla. Early in the year, and person, one thinking about physical health and how can we, better our physical health throughout the year. And since the beginning of the year, I have Dr. Nicholas Maraj, who is a neurologist and my resident medical doctor here in Unique Not Different to talk about how do we optimize physical health. So good morning, Dr. Nicholas, how you doing?
Hi, good morning, Shamla. I am fantastic. How you doing?
I'm fantastic as well. So let's get straight into it. So, what are the most important, I said, habits people can adopt to maintain optimal physical health?
So, optimum physical health requires some key areas to optimizing to make yourself as well healthy as you could. It involves nutrition, exercise, sleep, mental health and stress management, and maintaining some level of consistency in all of this to ensure that you achieve the right balance of work, sleep, nutrition, exercise to give yourself as much optimum physical health as possible to lead the best quality life that you can.
Right. So, in terms, you mentioned that, sleep and other stuff can lead to the best optimal health, right?
Right.
So, how do these factors like sleep, nutrition, and exercise work together to promote long term well being?
So they all combine to help the body become well managed in all its metabolic processes, such as the things inside of us that allow our brains to function optimally, to send signals from the top of our head to the bottom of our feet, to send signals to our heart, for our heart to beat properly, for our kidneys to function well. So those are the things that you need to put in place to let that happen. So nutrition specifically would be like eating a balanced diet with a variety of foods, necessary macronutrients, proteins, fats, carbohydrates, with the micronutrients such as vitamins and minerals, and focus to try and get those on fruits, vegetables, whole grains with lean, healthy fats if possible. Keeping yourself wild hydrated is a super important thing, especially in this lovely hot weather we have in Trinidad to prevent any sort of dehydration, and meal timing and portion control. That's also super important.
I guess it depends. Your meal proportion would be not it wouldn't be a one size fit all, but it would be like depending on your metabolism and your lifestyle as well.
That's 100% accurate, Shamala. 100% accurate.
So with so much influences around, given social media,
Yeah.
with so much information available about fitness and diet, how can people distinguish between fads and scientifically backed approaches to health?
Well, that's a very interesting question. So, fads are things that you tend to see year after year coming. Sometimes fads go out of vogue for a couple of years and come back several years later. You always hear different types of diets, such as the keto diet or the Atkins diet, where different people do certain types of um, dietary treatments for a prolonged period of time. Some people claim that things work, some people claim that they don't. What is important is having a consistently healthy diet that's been proven over time and time again to optimize physical nutrition. And one of the more important ones is the Mediterranean diet that has been proposed by the Framingham study many, many years ago from cardiac health. And that is the whole grains, nuts, fruits, vegetables, lean meats, um, and low fat kind of content. That would be the more optimal nutritional status for most individuals. Now, it's not a one size fit all because, like, let's say certain patients have like a history of kidney stones or certain types of other medical ailments. The most important thing is to consult your healthcare provider prior to starting any new sort of diet because that could affect your quality of life.
And sometimes that can be very, very expensive.
Oh, It's a very, very important question indeed. The way
Yeah.
things are right now,
Yeah.
finance is super important.
So, in terms of like, what role does mental health play in physical health, and what can people do to manage stress for better physical outcomes?
Well, there's the mind-body connection where the optimal mental health that somebody has a significant impact on their physical health. So for people who may suffer with mental issues such as depression, anxiety, that could physically impact them, causing them to get less sleep, making them feel they eat less, their diet is a bit off, they don't exercise as much as they're supposed to. So what would involve is treating any underlying mental health issues that somebody would have at a point in time. And the typical type of thing, everybody has stress. It's just management of the stress is the most important. So mindfulness and relaxation, exercises, certain apps on your smartphone have been useful in helping patients achieve this. Yoga. Really important is social connections with people and friends that build you up and keep you in check rather than allowing you to kind of roam free and delve into yourself too much. And preventative care is super important, such as regular checkups with the mental health type of team, especially if you do have like a mental health condition undergoing.
Yeah. So, as we age, our bodies undergo many changes. What are some preventative steps people can take to maintain physical health as they get older?
One of the most important things is if somebody is smoking, to stop smoking. That's really important. Cutting down on their alcohol intake. So you can see lots of studies these days showing that there's no safe amount of alcohol to people to drink. Previously, it used to be okay for a woman to drink maybe 1 unit of alcohol and a male to drink two. Studies nowadays looking more at promoting no alcohol content whatsoever because it increases the risk of cancer. And physical exercise is super important. Cardiovascular, strength training, and as people get older, flexibility and mobility training to keep your spine, your hips, your joints healthy. All those things are important. And really important in physical exercise is rest and recovery also. Can't can't leave that out.
What about somebody who is sedentary? Somebody who, okay, so for example, okay, so everybody sitting on a wheelchair are different, right? I move in a lot, but there are some persons who cannot move. For example, a paraplegic, right? What would you advise to them?
So if you're paraplegic, at least your upper body could still have mobility. So
Right?
you need to have physical exercise, get at that. More upper body strength, core strength if that's necessary, and there's still passive physiotherapy exercises for the lower limbs to make sure that they don't get contractures or sores or any sort of trouble like that. Physical exercise for the upper body, passive exercise for the lower part.
I'm not too sure if you're able to answer this question, right? But in terms of people who suffer with anxiety and depression, and let's say things change, meaning things suddenly change. And we just talk about physical and mental health coexist with each other, right?
Yes.
Does anxiety aggravate physical health in terms of, like, for example, if you have body pain and then you get anxiety, does that body pain aggravate through anxiety?
That's a very, very good question. So there's the mind-body connection where certain underlying troubles. So, example, let's say you damage a part of your joint, or let's say injure your hand, and the mental connection between the physical pain and the neurons in your brain, it can establish a positive feedback pattern where the pain, once the initial inflammation has passed, can go on to become chronic. And somebody can perceive that even though there's nothing physical going on at the body part that's damaged before, there can be this perception of chronic damage that's gone on, and that can exacerbate any little underlying condition.
That makes sense. I guess it's a habit of the brain, so you have to work to rewire that thinking.
That is a fantastic thing because everybody can rewire their brain once they give the right opportunity and right skill set.
And changing of habits. So, in terms of, can you discuss the importance of regular health checkup and screenings, and how can they help in early detection and potential health issues?
Screening is super important for different types of medical issues such as cardiovascular disease, respiratory disease, cancers specifically. So for women, regular pap smears are important, regular breast examinations, mammograms when they're in a specific age group, especially if somebody has a family history of any type of cancer. For males, it would be prostate cancer screening, especially if you have a family history of it. Prostate cancer screening involves the blood test as well as the digital rectal examination. I know many men don't want to hear that, but it's super important. Colon cancer it's much more common
Yeah.
nowadays, especially with many different factors. So certain bodies are advocating for earlier colon screening with a colonoscopy. It used to be 50 back in the past. Now it's coming down to 45, even 40 in certain patient demographics.
Yeah. So, given your experience in the health sector, right? What and your observation, what advice would you like to give Trinidad and Tobago in terms of what you have observed, in terms of people just do, in terms of people not wanting to, I guess, get any medical attention if they have certain, again, simple things that they may take for granted.
What I would advise Trinidadians definitely is that we live in one of the best countries in the world in terms of food. The food that we have here is one of the tastiest, yummiest food, but it's very salty, very high in carbohydrates and fats. So portion control and trying to eat a better, healthier diet is super important. We live in a carnival type of culture, so be very judicious with your alcohol intake. Right now it's carnival time, so everybody exercising and want to get their body fit for carnival. Try and maintain that sort of exercise routine throughout the year so that it don't just be a sporadic thing. By adopting a healthy exercise routine into your general daily life, that can give you some discipline, and that part of physical discipline helps mental discipline also and helps with mental health moving forward. So that would be my advice to Trinidadians generally.
Dr.
Physical
Nicholas,
exercise and diet.
Dr. Nicholas, it's always a pleasure. I know I'm going to see you again throughout the year.
For sure.
Different topics. So thank you so much for coming and always sharing your time and knowledge, experience, and expertise with us in different areas. And I wish you all the best for 2025, and I'll see you again.
My pleasure, Shamla. All the best for you to 2025 and have a lovely day, Trinidad and Tobago.
Thank you very much. And guys, with that being said, I want to say thank you so much for tuning in this week's segment of Unique and Different. As I always say, be good. Be good. Bye, everyone.